The fluorescent lights hummed their endless mechanical drone as Laura Bennett moved through Sacred Heart's ICU in San Diego, a ghost in scrubs among the living. She didn't announce herself. She didn't need to. The ventilators wheezed their rhythmic breath, the monitors beeped their steady surveillance, and somewhere in the organized chaos of the night shift, a quiet nurse was doing the work that kept people alive while doctors slept in cool rooms. Dr. Marcus Ashford watched from the physician's desk, his eyes cataloging what he saw as weakness, the downcast gaze, the apologetic posture when she approached with a clarifying question, the way her voice never climbed above a whisper even when the code alarm screamed. He didn't see the precision. He didn't see the hands that moved like surgical instruments, each motion calibrated to the millimeter. He saw only a mousy nurse who needed managing, and he filed that observation away the way men like Ashford filed everything, as ammunition for later. Laura's shift had begun at 1900 hours, though she never thought of time in military terms anymore, hadn't for 3 years since the IED in Tikrit shattered her hip and ended Major Laura Bennett's career in field medicine. That was another life. That was another name on another dog tag. Now she was just Laura, the nurse who checked medications 3 times instead of once, whose hands never trembled during central line placements even when the patient's family watched from the corner like hawks, whose left hip caught sometimes when she'd been standing too long, her asymmetry so small that only someone trained to notice movement would see it. Ashford hadn't noticed yet. Ashford was still cataloguing her as safe, manageable, the kind of subordinate who could be shaped into compliance. The ICU nursing station occupied the heart of the unit, a curved desk surrounded by monitors that flickered with vital signs, each screen a small window into crisis or stability. Laura sat in the grey ergonomic chair at 2,130 hours, her fingers moving across the keyboard with deliberate precision as she documented the vitals for the patient in bed 7, the one who'd been assigned just this afternoon. Routine post-op monitoring. Nothing unusual in the paperwork. She pulled the medication cabinet drawer toward her and began the ritual she performed for every single dose, every single patient, the ritual that Ashford had already begun to see as obsessive rather than professional. Triple verification. Dosage. Patient name. Route of administration. She wrote nothing down. The information lived in her muscle memory, in the part of her brain that had been trained to function under mortar fire, under the kind of pressure that turned most people to stone. Ashford stood 15 feet away, leaning against the counter with a cup of coffee that had gone cold an hour ago, watching. Watching the way her eyes stayed fixed on the medication label. Watching the slight tremor he thought he saw in her fingers. He would be wrong about that tremor, but he wouldn't know it. He would spend the next 72 hours building an entire edifice of management strategy on the foundation of what he thought he'd seen, completely unaware that the tremor he observed was not fear but restraint, not weakness but the effort it took to hold back someone whose training had taught her that hesitation got people killed. Bennett. His voice cut across the ICU like a scalpel. Not unkind. Not yet. Just possessive, the way a man speaks to property he intends to rearrange. Documentation on the new admission. She didn't jump. That was important. She turned with the economy of motion that came from decades of training, one shift of her shoulders, a quarter turn of her head, and Ashford's coffee cup paused halfway to his lips. There was something in that movement that made the hair on the back of his neck want to stand up, something that felt like recognition of a predator, but he suppressed the instinct immediately. Ridiculous. She was a quiet nurse in a teaching hospital with hands that moved carefully and eyes that never met his directly. She wore her anxiety like a uniform. Right away, doctor. Her voice came soft, deferential, the voice of someone accustomed to being dismissed. The voice of someone who had learned that invisibility was safer than being noticed. She turned back to the computer and called up the file for bed 7, the new admission who would arrive tomorrow morning at 0600 hours. Post-operative cardiac monitoring, 3-day protocol. Nothing marked as critical. Nothing that would suggest the man sleeping in the pre-op area had once held her future in his hands, had once sat across from her in a formal hearing room in Tikrit and rendered a judgment that ended a career. She didn't know yet that he was coming. The assignment had just been entered into the system, a name and a diagnosis and a time stamp. She pushed the information down the way she'd learned to push everything down, the way soldiers do, and moved to the next medication verification. The night shift at Sacred Heart smelled like antiseptic and burnt coffee and the faint, underlying sweetness of human suffering that no amount of ventilation could fully mask. Laura moved through it like someone walking through water, present but untethered, doing the work while the world moved around her in its usual oblivious way. The monitor in bed 3 trended slightly elevated on the patient's blood pressure, 140/88, climbing from the 2,100 baseline. She made a note, reviewed the latest labs, and was already planning the adjustment she would recommend to Ashford when he finally bothered to check the trends. But he wouldn't ask her recommendation. He would tell her what to do, and she would do it, and if it worked, he would take credit, and if it didn't, well, that was what performance improvement plans were for. In the break room at 2,245 hours, 3 nurses were mid-conversation about the new resident when Laura pushed through the door. Their voices dropped by half. Mandira, who'd been talking about her daughter's soccer tournament, suddenly remembered a stack of charts that needed reviewing. Chen excused himself to check on his patient. Only Rodriguez stayed, and that was because she was new enough not to understand the social choreography yet. But Rodriguez watched as Ashford passed by the break room window 5 minutes later, and when he saw her sitting with Laura, something in his expression shifted like a door closing, and Rodriguez would remember that look tomorrow when the other nurses started being very busy whenever she stood too close to him. Ashford was competent at this, the slow orchestration of isolation. He never said anything direct. He never had to. A raised eyebrow. A comment dropped into the right conversation. A suggestion planted like a seed that grew roots while no one was paying attention. I've noticed Bennett seems a bit uncertain with the new protocols. Have you noticed how long she takes to document? Wondering if she's keeping pace. Someone mentioned she questioned my order last week. Concerning, for someone at her experience level. None of it was untrue. None of it was quite true either. But truth was negotiable in the hands of someone with institutional power, someone whose brother-in-law sat on the board of trustees, someone whose research grants gave him leverage that extended far beyond the ICU. Laura sat alone in the break room after Rodriguez left, the fluorescent lights casting everything in a pale, medical white. She reached up beneath her scrubs to the place where a dog tag hung on a broken chain, the metal worn smooth from years of touch, from nervous fingers finding it in the dark. The engraving on it was faded but still legible to anyone who knew how to read military designations, the name of someone she used to be, the rank she no longer claimed, and a set of dates that marked the span of a life that had ended in a hospital in Kandahar 3 years ago, though the body had kept walking around for quite a while afterward. She held the dog tag for a moment, the chain gossamer thin against her neck, and then let it fall back beneath the cotton of her scrubs, a secret that no one in this building would ever understand. The dog tag was the only piece of her past she'd kept, the only tangible proof that Major Laura Bennett had existed at all, and she wore it the way monks wear reliquaries, not for faith, but for remembrance of something sacred that the world would never see. She returned to the ICU at 2,300 hours. The monitors continued their endless conversation, telling the stories of bodies in crisis, bodies in recovery, bodies in the liminal space between both. She checked the new admission paperwork one more time, her eyes catching on the name and the military designation, and something in her chest went very still. But still, that was different from frozen. Still was controlled. Still was the absence of reaction, not its victim. She made a note in the system that medication verification was complete and locked the cabinet, and as she did, her hands, those hands that Ashford thought were trembling but which were actually steady as surgical lasers, moved through the motions of a woman who had learned to survive by staying invisible, by doing impeccable work, by never giving anyone a reason to look too closely. The morning would bring the new admission. The morning would change everything. But for now, the night shift continued its quiet work, and Laura Bennett moved through it like a ghost, like a person who had died once already and was simply going through the motions of living that made the rest of the world comfortable. The morning came with the rhythm of monitors and the soft hiss of ventilators, the ICU at Sacred Heart moving through its choreography of beeping alarms and rolling carts. Laura entered bed 3 with the chart already in her hands, eyes tracking the vasopressor dosage Ashford had written at 0600 that morning. Phenylephrine. The calculation was elegant on its surface, dangerous underneath. She'd seen IEDs that looked elegant too, right up until they detonated. The family was there. Wife in a beige cardigan, holding a daughter's hand, the kind of civilian worry that hadn't yet learned to ration hope. Ashford stood at the foot of the bed, his posture the kind that announced authority before his voice did. Laura approached with the medication verification sheet, stopped at the safe distance she'd learned to maintain, and spoke quietly enough that only he could hear. "Doctor, the phenylephrine dosage appears miscalculated. The standing order is 0.4 milligrams per kilogram per minute. The patient weighs 90 kilos. Current order writes for 90 units per hour." The room didn't change. The monitor kept its rhythm. But something shifted in the air pressure, the way it does before a storm. Ashford turned to face her fully, and his smile arrived first, preceding his voice like a ship's wake announces the hull. "Nurse Bennett," he said, voice smooth as surgical steel, "when you complete medical school, I'll welcome your mathematical contributions. Until then, observe the hierarchy we maintain for patient safety." The wife's hand tightened on her daughter's shoulder. Ashford walked past Laura without checking his calculation. The phenylephrine order would stay exactly as written, and every nurse on the unit would wonder if she was wrong or if he was right, and in that uncertainty, his authority would compound like interest. Laura took one measured breath. She'd learned to breathe before the mortar started, and before the IED, and after it too. She let a single tear trace her cheek, not from fear, but from the effort of containment, the way pressure builds behind a dam. She wiped it without breaking eye contact, her hand steady as a surgical laser, and said what she hadn't been supposed to say, what nurses didn't say to doctors in front of families, what the hierarchy had been designed specifically to prevent. "I've made harder calls than this, doctor. I'm still standing." Ashford's jaw tightened. He said nothing. He didn't have to. By that afternoon, the bulletin board near the nursing station bore a fresh document, printed on hospital letterhead, bearing Laura's name in the first paragraph. Performance Improvement Plan. The reasons listed with the precision of someone building a case, unauthorized deviation from physician orders. Insubordination. Failure to respect chain of command. Times and dates and witness names, each one carefully placed like tiles in a mosaic. The document was meant to humiliate, yes, but more importantly, it was meant to isolate. Every nurse who passed would read it. Every physician would see it. By the next morning, Laura's name would be synonymous with the phrase "doesn't follow protocol," and in a hospital, that was a wound that didn't close. The break room at 1400 held for nurses mid-conversation when Laura entered with her lunch, a container of rice and vegetables she'd prepared at home, the kind of meal that asked nothing of the world. Maria was talking about her weekend plans, something about a beach in La Jolla. James was laughing. The moment Laura set her lunch on the table, the conversation didn't just pause. It fractured. Maria suddenly remembered she needed to check on a patient. James had documentation that couldn't wait. Within 45 seconds, the four of them had evaporated, leaving behind only the smell of burnt coffee and the feeling of orchestrated absence. Laura sat alone at a table with 8 empty chairs surrounding her like accusers. Her sandwich remained untouched. She could hear the whispers moving through the unit like contamination, words Ashford had planted with the precision of a farmer scattering seeds, questionable judgment, doesn't respect protocols, liability waiting to happen. She ate in silence, chewing mechanically, each swallow an act of will. The dog tag hung cold against her sternum, hidden beneath her scrubs, a weight that felt heavier each day. She'd worn it for 3 years without anyone knowing what it meant, not the rank, not the unit, not the 2 names engraved on its opposite side, both gone now, both because of a decision she'd made in Tikrit under fire. That was why she'd hidden it. That was why she'd chosen to disappear into Sacred Heart's ICU, into the invisibility of a quiet nurse doing quiet work, into a life where no one knew what she'd been because she'd paid too much to become who she wasn't. But the unit was changing her. The humiliation was teaching her something about restraint, how to swallow words that could have ended Ashford's career before breakfast, how to smile while being dismantled, how to stand while being erased. It was a different kind of survival than Tikrit. Quieter. Slower. In some ways, harder. At 18:30, a new patient arrived in bed 7, transferred from recovery, still sedated from surgery. Laura read the name on the wristband and her vision tunneled for exactly 3 seconds. Commander Jackson Reeves. Navy SEAL. The same officer who'd convened the court-martial in Tikrit 3 years ago, the same man who'd questioned her judgment for those split seconds when she'd triaged the 2 Marines ahead of the congressman's son, the same decision that had nearly ended her career and absolutely ended her marriage to the army. She hadn't seen his face since the hearing. Ashford reviewed the chart, notes indicating Laura assigned as primary nurse, and his smile didn't reach his eyes. It was the smile of someone who'd just been handed a weapon. "Our little rule breaker with a critical patient," he said to the charge nurse, loud enough for Laura to hear. "Let's see how that works out." During evening rounds, he staged it with the precision of someone who'd been planning it without knowing the opportunity would arrive. Reeves' adult daughter was present, a Marine lieutenant with her uniform still carrying the crease of travel, 2 residents witnessing from the doorway. Ashford positioned himself at the bedside, turned to face Laura, and asked his question like a prosecutor who already knew the answer. "Walk me through your assessment plan, Nurse Bennett. Slowly, so I can identify the inevitable gaps." He used the nickname he'd been testing on other staff, Little Mouse. Laura's hands rested steady on the medication cart. She'd held weapons steadier, held dying Marines steadier, held herself together steadier. One measured breath. She didn't wipe away tears this time because there were none to wipe. She held his gaze with the kind of eye contact that felt like a threat, and when she spoke, her voice had lost the deferential lilt it usually carried. "My assessment is complete and documented per protocol, Doctor." Ashford turned to the daughter as if Laura hadn't spoken. "We're working on developing her confidence," he said, voice pitched toward sympathy, the kind of tone doctors use when discussing broken equipment. The daughter's expression remained neutral, but something flickered across Reeves' semi-conscious face, a frown, a stirring, the sound of someone trying to surface from underwater and not quite making it. The sound of monitors was all that filled the space after that. Over the next 4 days, Ashford's campaign became surgical in its precision. He didn't raise his voice. He maneuvered. Laura arrived for her Wednesday shift to find she'd been reassigned from bed 7 to bed 12, the stable post-op appendectomy patient requiring minimal intervention, the kind of assignment reserved for staff who needed supervision. The staffing board showed Jessica covering Reeves now, though Jessica had half Laura's ICU experience, though Jessica had called in 3 times in the last month for anxiety. When Laura questioned the charge nurse, she got a tired shrug that said everything. Dr. Ashford requested the change. Said something about appropriate skill matching. Thursday morning brought the discovery that her access to the electronic physician order system had been restricted. She could view medications but not acknowledge critical orders without a second nurse co-signing, a limitation typically reserved for new graduates, for people still learning. Each cosign was a small public branding, a visible marker of diminished authority. The IT ticket referenced a physician request for additional safety oversight on employee 4738. Her employee number. Her diminishment. She worked the shift in silence, and by day's end, every nurse on the unit had seen her wait for Maria to co-sign a standing insulin order. By Friday, they would all understand she was being treated like a liability. Friday morning, Ashford made his phone calls from his office, door half open so his voice carried naturally through the unit like humidity, impossible to ignore. To the chief medical officer, concerning patterns I've been documenting. To risk management, proactive intervention before an incident occurs. To board member Dr. Patricia Chen, the one with the connections that mattered, a staffing situation requiring delicate handling. He was building a paper trail, each document carefully worded, each witness strategically positioned. By the end of the day, someone in administration would have already flagged her name. Saturday brought the department meeting. Ashford introduced a new collaborative care protocol requiring nursing staff to verbally confirm with attending physicians before any medication adjustment, even those with standing orders. Everyone knew it was the Laura protocol. She sat in the back row, spine straight, hands folded, silent, watching a rule be written specifically to contain her. That evening, she stood at Reeves' bedside during a brief moment between Jessica's break and the relief nurse arriving. He was awake now, recovering from post-operative sedation, his eyes tracking the room with the careful focus of someone emerging from darkness. He stared at her face for 10 seconds, something working behind his gaze, recognition trying to surface through the fog of morphine and propofol. He whispered 2 words, voice hoarse from the breathing tube. "Tikrit." "You." Laura's breath stopped. Her hands became suddenly aware of themselves. She glanced at the door, then back to his face, seeing the moment his eyes widened as something connected in his memory, not just her face, but her competence, not just her presence, but her rank, everything she'd buried now clawing toward daylight. She touched the dog tag through her scrubs, feeling the weight of 3 years of invisibility about to become something else entirely, and then she left without responding, her footsteps sharp against the tile, echoing down the corridor like a countdown already in motion. The ticking clock had started. Sunday evening. 21:45 hours. Laura pushed through the ICU doors, her break ended, her scrub still carrying the ghost of stale coffee from the break room vending machine. The fluorescent lights cast everything in that particular institutional white that made skin look like wax, that turned living people into something already half-preserved. She'd spent 20 minutes sitting alone in the basement laundry room, pressing her forehead against the cool metal door of an industrial dryer, letting the vibration move through her skull like a meditation. Like a countdown timer. The dog tag hung against her sternum. 3 years of invisibility, and now it was magnetizing toward exposure. She turned toward the nursing station to check the assignment board. That's when she saw him. Dr. Ashford. At the counter at this hour, reviewing charts, his tailored jacket draped over the back of a rolling stool like he'd just settled in for a casual evening. He was never here on Sunday nights. He was a day-shift surgeon, entitled to his weekends, his country club dinners, his careful distance from the complications of the ICU after hours. Yet here he sat, spine perfectly straight, reading glasses perched on the bridge of his nose with the precision of someone staging an entrance. He was positioned directly in front of Reeves' chart. Laura didn't break stride. She'd learned long ago that hesitation was a tell. She approached the board, scanned the assignment she'd expected to see, and watched the mental shift happen in real time. Her name? Beds 11 through 14. The medical surgical unit. Stable post-ops, chronically ill patients who required maintenance, not intervention. The assignment of someone being quietly benched. Ashford turned a page. Slowly. Deliberately. He wanted her to notice him there. Wanted her to understand that he was the one reshaping the orbit of this unit, one reassignment at a time. Nurse Bennett. His voice carried the texture of sandpaper on silk. You're not scheduled for bed 7 or bed 9 this rotation. I've made adjustments to better align your skill set with appropriate patient acuity. She turned to face him. Jaw tight. Breathing steady. The kind of composure that comes from having made decisions under mortar fire, from having moved through trauma bays where hesitation meant death. Dr. Ashford, Jessica is covering 12 beds on a Sunday skeleton crew. Bed 7 requires. Bed 7 is under my direct supervision now. He removed his glasses, folded them with the precision of a surgeon setting down instruments after a procedure. The patient's stability has become a priority that demands my personal attention. Your current skill assessment doesn't support that level of responsibility. It wasn't a request. It was a perimeter being drawn. He was building something. A narrative. A paper trail. Each restriction adding weight to a story he was already telling to people who mattered, administrators, board members, the pharmacy director he'd spoken to on Friday in that casual tone that carried the weight of institutional politics. She could see it now, how the pieces connected. The performance improvement plan. The social isolation orchestrated through carefully planted doubts. And now this, the active restriction from patient care, the assignment to the unit's safest beds, the message being broadcast through hospital policy that Major Laura Bennett could not be trusted with complex cases. Jessica looked up from the medication cart, her shoulders curved inward like someone already defeated by the weight of the shift. There were 17 hours between now and morning. 7 stable post-op patients in beds 11 through 14. And here in the ICU, Reeves' cardiac monitor beeped its steady rhythm, a sound that belonged to a man Ashford was very deliberately keeping Laura away from. Laura moved to the medication station, logged into the computer, and began pulling charts for her assigned patients. Everything by protocol. Everything impeccable. She would not give him the satisfaction of protest, of visible frustration, of the kind of emotional reaction that would justify every accusation he'd already filed. The trembling wasn't fear. It was restraint. It was the careful containment of someone trained to move through danger with nothing but her hands and her judgment. At 2310 hours, the alarm sounded. Not the soft chime of a regular alert. The urgent escalation that meant something had shifted in bed 7. Reeves' cardiac monitor showed PVCs, premature ventricular contractions. Irregular patterns breaking through the baseline rhythm. 1. 3. 2 in rapid succession. The pattern of myocardial stunning, the kind of electrical instability that preceded a cascade. Laura could see it from where she stood restocking supplies in bed 13, the sprint of the rhythm strip, the increasing frequency, the dark story being written in those jagged lines. Jessica moved immediately. Good instincts. Fast hands. But she was alone, and Ashford had vanished 20 minutes earlier, had stepped away with his phone pressed to his ear, his voice carrying into the hallway with the flat tone of someone conducting business that mattered more than the unit in front of him. Laura watched Jessica increase the beta blocker per protocol, watched her contact the attending's voicemail, watched her face shift through the stages of what every ICU nurse knew, the rising awareness that a patient was deteriorating and the immediate person responsible was unavailable. Laura approached the bedside. Careful, measured. Reeves' eyes were closed, his chest rising and falling with the assisted rhythm of a man still healing from catastrophic trauma. The 4 lines ran clear. The monitors hummed their electronic dialogue. Everything was liquid and fragile and temporary. His potassium, Laura said quietly to Jessica. What was this morning's result? Jessica's hands moved faster. Already checking. Already knowing. 3.2, it's ordered for replacement, but pharmacy hasn't delivered yet. Sunday night. Skeleton crew. The kind of delay that didn't seem intentional until you connected it to Friday's conversation in the hallway, the one about non-urgent electrolyte orders and how important it was to control the resource utilization metrics. Ashford had friends in pharmacy. He had the kind of influence that moved through institutions like current through water, invisible until something stopped working. Laura paged pharmacy stat. Direct code. Emergency electrolyte replacement. She waited. The monitor showed another burst of PVCs. Another. Another. Ashford returned at 23:40. He'd taken his time. He'd let Jessica and Laura manage the deterioration alone long enough to establish the narrative that the unit was understaffed, that decisions were being made in his absence, that someone, inevitably someone, would have to be blamed when a patient in critical condition didn't receive the intervention he required. He reviewed the strips with the casual confidence of someone who'd already decided how the story would end. His fingers traced the irregular rhythm. Magnesium bolus. Push 2 grams for over 20 minutes. Increase the cardiac monitoring to continuous. It was incomplete. It was missing the essential piece. Potassium. Low potassium didn't just cause PVCs, it created the electrical environment where arrhythmias could cascade into something lethal. Laura knew this. Her hands had done this. In Tikrit, in forward operating bases where the pharmacology was limited and the consequences were absolute, she'd balanced electrolytes and made the calls that kept people breathing. She stepped forward. Voice level. Professional. Careful not to cross into any zone that could be characterized as insubordination. Doctor, his potassium is critically low. He needs replacement before. Nurse Bennett, you're not assigned to this patient. Return to your zone. The room went so quiet you could hear the fluorescent lights hum, that constant electronic drone that existed behind every ICU moment, the white noise of controlled environments trying to contain chaos. Jessica's hand stilled. A medical student in the corner looked down at his tablet. Everyone understood what had just happened. Ashford had drawn a line. Laura had crossed it. And now she was being sent back to her cage. She walked back to bed 13, her movement smooth, her face empty. The kind of composure that revealed nothing. She pulled out her phone, hand steady, and texted the night supervisor, "Bed 7 needs rapid response standby. PVCs increasing. Electrolytes not corrected. Attending aware." She hit send. And waited. The supervisor didn't respond. Not at 23:45. Not at 23:50. The clock moved forward like a weapon being loaded. The dog tag felt heavy against her heart, each beat pushing it deeper into her skin, reminding her of exactly who she was underneath the scrubs and the quiet and the 3 years of invisibility. She was Major Laura Bennett. She had made calls in the dark that saved lives. She had bled into the sand in Tikrit and gotten back up. She had survived a court-martial and a disability discharge and the kind of silence that could break most people. And she was not going to lose this man to a power play disguised as protocol. Laura moved back into position, into the corners of the ICU where Ashford had tried to cage her, but her eyes never left the monitor in bed 7. She watched the rhythm. She counted the PVCs. She calculated the window remaining before critical instability, and she understood that she was standing at the moment where compliance ended and something else entirely began. The night was far from over. At 0200 hours, the monitor's alarm screamed like a wounded animal. Ventricular fibrillation. The rhythm sprawled across the screen in chaotic peaks and valleys, a cardiac storm that meant death was seconds away. Bed 7. Commander Reeves. The man whose name had haunted Laura for 3 years straight lined into crisis, and muscle memory took over before conscious thought could interfere. She was moving before Ashford's feet hit the floor. Laura called the code, voice steady as granite, "Code Blue, Bed 7. Trauma response." Her hands found Reeves' chest, positioned 2 fingers above his xiphoid process, and began compressions at exactly 100 per minute, the rhythm she'd learned under mortar fire in Tikrit, the cadence that had kept Marines breathing when their hearts forgot how. 1, 2, 3. Compress deep. Full recoil. 1, 2, 3. The mechanical precision of someone who'd done this with buildings shaking around her, dust falling like snow, her own hips screaming in pain as she worked on the floor of a combat hospital with nothing but field supplies and will. A resident appeared at her shoulder, eyes wide. "What do you need?" "Crash cart. EKG leads. 18-gauge line." Laura didn't break rhythm. Her voice carried the flat authority of medical necessity, not request. "Move." Ashford arrived 30 seconds later, already fumbling with the defibrillator pads. His hands trembled. Sweat beaded across his forehead like dew on grass. All his strategic competence, his board connections, his carefully orchestrated isolation campaigns, his weaponized policy citations, meant nothing in this moment. The crash cart was a language he didn't speak fluently. His mouth opened and closed without sound. The monitor showed no change. Asystole, then back to fibrillation. The first defibrillator shock discharged with a hollow thump. Reeves' body jerked like a marionette cut from its strings. Nothing. The monitor remained hostile. "Charge to 200, Laura said. Her hands never stopped moving. "Compress. Release. Compress. Release." The ventilator hissed its mechanical rhythm beside her. A nurse was drawing up epinephrine, 1 milligram, for push, and Laura accepted it without looking away from her work. The second shock came. Still nothing. The fibrillation persisted, defiant and deadly. For minutes without perfusion, someone said. The clock was running. Brain damage territories approaching. Ashford stood frozen beside the crash cart like a prop someone had forgotten to remove from the scene. Laura spoke without breaking compression. "I need the thoracotomy kit. Now." Silence. A resident looked toward Ashford, waiting for permission from the attending physician. Ashford's mouth worked. No words came out. "Move," Laura said. The single word carried the weight of command, the voice of someone accustomed to being obeyed. "He dies if you hesitate." The resident ran. The kit arrived in 40 seconds, surgical instruments on a sterile tray, the equipment of last resort. Laura didn't ask. She didn't wait for authorization. Her hands worked with the efficiency of muscle memory, movements that spoke of combat medicine in ways no civilian nursing certification could explain. She prepped the left anterior chest wall with iodine, the orange stain blooming across his ribs. Her hands moved like apex predators, fluid, precise, terrifyingly certain. The scalpel went in just below the fourth intercostal space. A line of red opened beneath her hands. She spread the ribs with a retractor, expanding the chest cavity until Reeves' heart lay exposed, still quivering uselessly in its chamber. No permission. No hesitation. No room for protocol when the alternative was death. Her fingers found his heart. Direct cardiac massage. Compress. Release. Compress. Release. His heart was warm against her palm, slick with blood, a muscle that had forgotten its purpose. She squeezed it deliberately, forcing its chambers to contract, forcing blood to move through vessels, forcing oxygen to reach his brain. The monitor watched. 60 seconds of direct massage. 90 seconds. 2 minutes. Ashford stood beside her, mouth open, finally understanding that he was witnessing something that transcended his understanding of institutional hierarchy. At 4 minutes, the monitor caught rhythm. A blip. Then another. The fibrillation smoothed into something organized, normal sinus rhythm emerging like light breaking through water. Reeves gasped. His lungs filled. His eyes moved beneath closed lids. Laura stepped back, hand steady, scrub soaked with blood and betadine and the evidence of what she'd just done. The ventilator took over, pumping air through his lungs, maintaining the rhythm her hands had restored. The room was silent except for the mechanical breath and the steady beat of a heart that had come back from the edge. Ashford stared at her like she was something he couldn't categorize, something that existed outside his understanding of nursing hierarchy and scope of practice and subordinate roles. For the first time, Laura saw something in his eyes that wasn't contempt. It was recognition. Unwanted recognition. "Someone call OR," Laura said to no one in particular. "He needs surgery to close this chest." She turned away from the bed, moving toward the supply room as if she hadn't just committed the most aggressive medical intervention a nurse could perform without arrest. Her hand stopped trembling once she was out of sight. By 0700, 5 hours after she'd saved Reeves' life, she was in the nurse manager's office. The air smelled of stale coffee and carpet cleaner. Ashford sat in the corner chair, phone already in his hand, and she understood immediately that he'd been busy. His calls were strategic, weaponized, brilliant in their calculated cruelty. He dialed the chief medical officer first, then risk management, then hospital legal, then his connection on the board, Dr. Patricia Chen, who owed him favors from his residency days. Each conversation had been framed precisely, artfully, with the care of someone who'd learned to wield institutional language like a surgeon wields instruments. Unauthorized invasive procedures performed by nursing staff, he'd told them. Scope of practice violations. Reckless endangerment exposing the hospital to catastrophic liability. The nurse manager wouldn't meet Laura's eyes. Her name was Helen. She'd always been kind before. Now she was a functionary, operating under the weight of legal exposure and administrative pressure. "We're placing you on immediate administrative leave pending investigation," Helen said. Her voice was soft, apologetic, which somehow made it worse. "Your badge and access, please." Laura removed her hospital ID from around her neck, the badge that identified her as just a nurse, just a mid-level employee, just something that could be removed and discarded. She set it on Helen's desk with the same precision she applied to everything. No trembling. No tears. No performance of emotion. She turned and walked toward the exit, Ashford's gaze following her like something predatory, finally satisfied with the destruction he'd constructed. The basement laundry room was a cavern of industrial machinery, the washers humming their endless mechanical cycle, the dryers thundering with the weight of wet cotton. The air was humid and hot, thick with the smell of detergent and bleach. Laura placed her scrubs into a laundry bin, the surgical blue stained with Reeves' blood, the white undershirt soaked with sweat and iodine and betadine. She'd folded them before, hundreds of times, but never like this. Now each crease felt like a goodbye, precise military corners, the fabric still carrying the scent of combat medicine. The dog tag rested cold against her collarbone beneath her shirt, visible only to herself. A single piece of her past, held by a chain that had broken years ago. She'd carried it through medical school, through her discharge, through 2 years of learning to walk without limping, through her reinvention as Laura Bennett, the civilian nurse with no past, no rank, no legacy except the one she'd buried. Now that past was clawing toward daylight, and she could feel it coming like distant thunder. In the recovery room upstairs, Reeves' eyes opened slowly, the sedation pulling back like fog over water. His voice was barely a whisper, weak as wind through dead leaves. Tickrit. A pause. His eyes found the ceiling. Major. He'd recognized her. 5 hours unconscious, nearly dead, with only seconds of wakefulness in the recovery bay, and he'd found her rank in the darkness and spoken it like a prayer, like an accusation, like a name someone had told him to watch for. The hospital's automatic background investigation, the routine check that Ashford had initiated thinking it would justify her firing, had flagged something peculiar in Laura's personnel records. Something that didn't match. Something that required federal review. By Monday morning at 0900, that flag had reached the right people, and by 1100, the conference room on Sacred Heart's 3rd floor was filled with individuals who understood what Laura had been all along. The hospital's routine background investigation, ironically initiated by Ashford to justify her firing, flagged something in Laura's records that required immediate federal review. It wasn't complicated. The investigator, a meticulous woman named Chen from the compliance office, had simply cross-referenced Laura's employment dates with her social security number. The system had rejected the query. Rejected it with the kind of encryption that only appeared in 3 contexts: active federal agents, classified military operations, and deep cover assignments. By Monday morning at 900 hours, that flag had reached the right people. By 1100, the conference room on Sacred Heart's 3rd floor was filling with individuals who understood exactly what Laura had been all along. The first to arrive was Reeves' daughter, Marine Lieutenant Sarah Reeves, in dress blues that moved like water across her frame, her bearing carrying the weight of something beyond genetics, the muscle memory of command. She pushed open the conference room doors and didn't wait for introduction. Her voice arrived before she fully entered, cutting through the nervous shuffling of hospital administrators. "You're questioning the credentials of a major." The room froze. Someone had briefed her. The hospital's chief legal officer, a man named Hutchins whose hands had been trembling since the federal notification landed, opened his mouth. Closed it. Opened it again like a fish searching for oxygen. Sarah Reeves sat down at the head of the table without being invited. Then Commander Reeves appeared, still pale from 5 days in the ICU, but moving under his own power in a wheelchair that his SEAL team leader, a compact man with the call sign Graves, positioned with precision. Reeves' color was better than the last time Laura had seen him. The monitors had shown sinus rhythm, steady and strong, for 72 hours straight. His chest still bore the marks of her hands, the surgical scars running through his sternum like a map of survival. Graves stood behind the wheelchair like a statue carved from granite, one hand resting on the chair's push handle. The room's temperature seemed to drop. Reeves looked at Hutchins with eyes that had seen things the hospital administrator would never access. "You want to know who saved my life?" His voice was rough from 5 days of intubation, but the precision remained intact, the voice of a man accustomed to being obeyed. "Bronze Star with Valor." He paused. Graves shifted slightly. The hospital board member beside Hutchins, a woman named Donovan who'd voted to terminate Laura that morning, suddenly understood the geometry of what was happening. Another pause. Purple Heart. The words landed like judges' gavel strikes. Combat medical badge. Hutchins' legal pad slipped from his hands and clattered against the polished mahogany table. The sound echoed like an accusation. An FBI liaison stepped forward, her credentials hanging from a lanyard with a kind of official gravity that made institutional authority look like a child's costume. She was younger than expected, maybe 40, with the flat, efficient voice of someone who'd processed 100 explanations exactly like this one. Major Laura Bennett's medical discharge from the United States Marine Corps wasn't medical. She pulled a folder from her briefcase and placed it on the table. The folder didn't open, it just sat there, sealed with the weight of classification. Her hip injury was sustained in service, yes. The discharge was cover for a classified 3-year mission training field medics in contested territories. Her civilian nursing at Sacred Heart was a deep cover assignment. She let that sentence breathe for 3 full seconds. An assignment now compromised by Dr. Ashford's investigation into her personnel file. The words moved through the room like a contagion. Sarah Reeves' jaw tightened almost imperceptibly. Graves' expression didn't change. He'd clearly already known. The federal forensic accountant arrived next with boxes, not meticulously stacked, but methodically arranged, each one labeled with a date range. They began opening them Tuesday morning while the hospital's legal team contacted counsel. By Wednesday, the pattern was undeniable. 37 instances of upcoding procedures. 16 cases where Ashford had documented interventions he'd never performed. Patient charts altered after adverse outcomes, the timestamp scraped and rewritten with surgical precision that suggested someone who understood exactly how to hide his work. The investigation found witness after witness stepping forward, nurses reassigned for questioning his orders, a resident blocked from a fellowship after reporting a medication error, a surgical tech who documented Ashford leaving procedures to take phone calls while patients remained under anesthesia. Each retaliation matched a specific pattern. Each pattern connected to another. The federal agents moved with a kind of methodical precision that suggested they'd been expecting exactly this. The hospital's board held an emergency session Wednesday evening. Sacred Heart's legal exposure was catastrophic, federal fraud charges, malpractice claims that Ashford's falsified records would make indefensible, and the public relations disaster of terminating a decorated combat veteran to protect a criminal. Dr. Patricia Chen, the board member who'd been Ashford's closest ally, personally moved to terminate his medical privileges effective immediately. The vote was unanimous. Thursday morning, Ashford arrived to find his office locked. His computer access revoked. A security escort waiting with the kind of professional courtesy that made termination feel like a state funeral. He was permitted 15 minutes to collect personal items. He tried calling contacts, his network of strategic relationships, the careful architecture of influence he'd spent a decade constructing. Phones went to voicemail. Associates suddenly had other commitments. The strategic web he'd built now understood that association with him was radioactive. His medical license entered emergency suspension pending state board review. His attorney delivered the news Friday: wire fraud charges, false statements in medical records, felonies carrying potential prison time. The plea deal required surrender of his license, restitution of $340,000 in fraudulent billing, and cooperation with investigations. His marriage lasted until month 3. 6 months later, the consequences had fully metastasized. Ashford's professional reputation was ash. No hospital would touch him. His retirement accounts frozen pending restitution. On a Tuesday evening, Laura entered Sacred Heart for a night shift. She'd been reinstated with back pay, formal apology, and a promotion to clinical nurse specialist with authority to override physician orders in emergencies. She walks past the employee entrance and the motion is so natural, so unforced, that it doesn't register as deliberate until Ashford is already behind her. He works the night security desk now. His badge reads security across the chest, replacing the credentials that once moved through every locked door. His job is checking IDs, monitoring cameras, calling maintenance for broken lights. He watches her approach, recognition flashing across his face like a lit match in darkness. Laura walks past with the same quiet dignity she's always carried. Doesn't slow. Doesn't acknowledge him. The two dog tags beneath her scrubs, her own broken chain and Reeves' recovered twin, the match found in Tikrit rubble and returned by Graves, rest against her heart where they've earned the right to stay. Ashford watches her disappear through the ICU doors, the glass sliding shut with a pneumatic hiss that sounds like finality. He's sealed outside the world he once controlled. 3 months after Ashford's final fall, Laura leads the ICU's new trauma response training. She teaches nurses and residents the field medicine techniques that saved Commander Reeves' life, her hands moving through the procedures with the same precision she brought to his thoracotomy. The hospital has overhauled its protocols, creating pathways for nurses to perform emergency interventions when physicians freeze, built entirely on her recommendations. Reeves has recovered fully, returns to limited SEAL training operations, and visits Sacred Heart quarterly to guest lecture on combat casualty care. His daughter Sarah collaborates with Laura on a veteran transition program that helps medics become civilian nurses without erasing their past. The program's first cohort includes 6 former combat medics who no longer have to hide their service. They wear their history like something earned, not something shameful. On a quiet Sunday morning, Laura finds a letter in her employee mailbox, forwarded through multiple channels, postmarked from a federal correctional facility. She opens it in the break room. His handwriting is precise, the same strategic mind that engineered his rise and fall. I saw weakness where there was strength. I saw a threat to hierarchy where there was integrity. I weaponized the system I claimed to protect. You showed me what quiet dignity looks like. I have 18 months to learn it myself. She reads it once, folds it with the precision she brings to everything, places it in her locker. She doesn't respond. Some lessons arrive too late. That evening, Laura sits in bed 7, now occupied by a young Marine, polytrauma from a training accident, family gathered and terrified. She explains the treatment plan with calm authority, her voice steady and clear as a command frequency. The Marine's mother grips her hand. Thank you for being here. Laura touches the 2 dog tags beneath her scrubs and says, "It's what we do." As she walks through the ICU at shift change, past the bulletin board where her performance improvement plan once hung and where now hangs a photo of the Veteran Transition Program's graduation, past the break room where colleagues save her a seat and share coffee, she thinks about Ashford checking IDs in the lobby below. The monitors beep their steady rhythm. Voices call for supplies. Somewhere a ventilator wheezes like a living thing. Major Laura Bennett, who learned to be invisible, who was forced to be visible, who chose to be unbreakable, moves through Sacred Heart's ICU with the quiet competence of someone who knows exactly who she is. She's held together through Tikrit's explosions, through the court-martial that ended her military career, through an IED that shattered bone and rebuilt her into something harder. She's held together through Ashford's calculated cruelty and through saving the life of the man who destroyed her. She's still standing. She'll always be standing. Thank you for following Laura's story. If you believe quiet strength deserves recognition, subscribe for more stories about the people who hold us together when we fall apart. Like this video, and tell us in the comments, have you ever been completely misjudged by someone in authority?